We're being joined now by Dr. Janet DeMille. She's a medical officer of health for the Thunder Bay District, and she's here to discuss the COVID-19 situation in our area. Dr. DeMille, good morning.
Good morning, Sean.
Now, how would you say our situation has changed or evolved since last week?
You know what? We're still seeing a fairly high number of cases. Of course, the ones that we receive at the health unit are just a proportion of the total number of people that might actually have COVID. So the ones that are higher risk are associated with certain settings like healthcare or other congregate settings. And, our numbers sort of tend to go up and down a little bit every day, but I haven't really seen, any sort of evidence of a decline or a meaningful decline at this time. And it does seem like even over the last week, we were maybe managing a few more outbreaks in congregate type living settings, and that overall feels like we're still in a very significant situation in terms of the Omicron spread. And when I consider all the numbers, like our daily numbers, our outbreak numbers, we now are looking, closely at some of the wastewater surveillance data from Thunder Bay, which, we're still sort of navigating how that is contributing to our overall assessment of the situation. And I would say we are, not clearly declining, but perhaps there is some evidence that we're stabilizing in terms of the numbers, and that, of course, you have to, when numbers go up, they stabilize and then they go down. So I'm hoping to see something a little bit more concrete over the next even 3 to 5 days or so, and with respect to all of these, to know exactly where we're at.
Now, last week we talked about an outbreak that was declared at the shelter house. What's the latest on that situation and efforts to control the virus in vulnerable populations?
Yeah, so it's really still a very active outbreak. I think there's maybe around 20 individuals that have been confirmed positive associated with that, and there's a lot of work that's being done to sort of support individuals, manage people. The isolation shelter, a static bed list at the shelters, so and some cohorting of individuals, and when people, sort of moving people around. So if people, when they have COVID versus when they've recovered from COVID, and then those who are maybe high risk but aren't necessarily showing signs of COVID. And there's a lot of testing being done, so testing of anybody who's symptomatic, but also some routine testing so that people can, pick up, identify individuals who may have COVID and then manage them or support them. And, I think we did this last year as well when there was an outbreak in that population, and it was a lot of work. But I think there's also been a lot of lessons learned by all parties based on that, and I think it is a lot. Still remains a very active issue, but I think it's being managed, and I do expect that it will. Hopefully it too will show signs of settling.
Now, what about the outbreaks at the jail and correctional center? What can you tell us at this time?
Yeah. So the outbreak at the jail, which is still, I think it was a little over a week ago or so, or a bit more, but really impacted a lot of people. So the number of directly people impacted, and that could include sort of inmates at the jail or staff or others. It is well over 100, the number there. And, we do expect to see that to settle because there's, quite frankly, not a lot of people that necessarily were untouched. So, that was a very significant situation. And fortunately, people have done overall well and are recovering. So that's okay. The correctional center, there was a round of broader testing done the other day, and I think the results, still waiting for some of the results, or they came in overnight, and hoping, that will give a much better sense of what's happening there in terms of how significant the spread may have been, or hopefully, maybe there really wasn't spread, which would be very good.
Now, recently, our region surpassed 300,000 total doses of vaccines.
Yep.
What do you want people to know about the latest vaccine figures?
So, you know what, I just want to really express my appreciation for everybody who's coming into the clinic. There's and actually the clinics, and we have many partners that are involved. So people have access in a number of places, and we are still delivering, first and second and third doses, even some fourth doses in long-term care right now. So, that gets us up to that 300,000 number, which is significant. I will say, first, I'll talk about two groups. Just everybody, and getting a booster dose, so that third dose, if they're at least 84 days after their second dose, there is real evidence that that booster dose is protecting people from getting infected with COVID-19. And, of course, if somebody isn't infected, they're not passing it on to others. So that's a really big way for people to protect themselves, but also to help reduce transmission in the community and whatever settings, in their family or, school or other, their workplace even. So really encouraging people to get that third dose and just sharing that there's really a lot of evidence that it does work. We're at around 48% of people 18 of age and older having had that booster dose. So that's really good. And we see that the number is higher in those who are older and more vulnerable for COVID. So that's great. But still, there's a lot of people that still are eligible for a booster dose who don't have it yet. The other group I'll mention is the 5 to 11-year-olds. So we're currently around 51% across the health unit area for that group having had their first dose. Next week, we're starting the first round of second doses for those who really got theirs 8 weeks ago. So we're really preparing for that, both in Thunder Bay and district communities. But really encouraging, parents or caregivers of children 5 to 11 who haven't received that first dose to really consider getting it. It does provide protection. It's very effective. It's safe. And again, that will, children getting immunized will help that child, but also their family, their school, now that they're all open, and other things that they may do. So really encouraging that. And just to let you know, we're going to be changing our model a little bit, and here in Thunder Bay, the Heritage Building will be used for 5 to 11s, and we're going to open it up for walk-ins for the 5 to 11s who haven't had their first doses. For people for second dose, we want them to keep their appointments. A lot, again, coming up next week, and some more are available. But we will be supporting people, kids coming in at the Heritage Building through walk-ins.
Now, what do you make of Canada's recent approval of the new oral therapeutic Paxlovid that's expected to hit the market soon?
Yeah, so I think, that's something that in public health we're less involved in terms of the therapeutics, but certainly have always, appreciated that, the treatments for individuals who have COVID, and especially to sort of reduce the likelihood of having severe illness was going to be important component of bringing this pandemic under control or really would really help us. So it's really exciting to hear about that, the approval. I think that, the same that we experienced with vaccine, there's going to be some supply issues and before it's sort of more widely available. But I think, that's just another tool in a toolbox to help get through this pandemic. So it is exciting.
Now, it's been recently reported that an announcement is coming shortly that would lift some restrictions in Ontario. How do you feel about that, and how do you think that's going to affect the people of Thunder Bay? So I sort of feel a little bit mixed, to be honest. At some point it would
it's very appropriate. I think we absolutely need to consider the removal of public health restrictions or the backing off of public health restrictions because they are significant. That it is about businesses and the economy and people's ability to do more things. And I think that that's important. I have to say, and of course not all the details are out, but I'm a little bit concerned about the timing of this. We've just had schools open in our area. It takes a couple of weeks to really see the impact of that. I know the university will be opening, and that all in-person learning is really important. And we are not sure yet, really, of the real-life impact that will have on our COVID numbers. I mentioned to you earlier that I think we haven't necessarily peaked in this area. I think we might be at the peak right now, but I would like to see very concrete evidence that we're kind of coming down the other side. In short order, I'd feel more comfortable with the removal of restrictions. I know actually yesterday on some data that I received, the Thunder Bay District is one of 8 health units that really hasn't seen maybe some stabilization, but not a decline, whereas other health units have. So maybe we're a little bit behind some of the rest of the province. So I think that, when we start removing restrictions and, having kids go back to school, and which has already happened, we're going to be interacting more with one another, and that has the potential to increase transmission. So it's all these factors, a lot of factors in place that are reducing transmission, including the booster shot. But when we start, opening up more, that will actually increase transmission. So I'm feeling a little bit, kind of mixed about it. I'm excited that about the eventual removing of restrictions, but I'm really hoping that it will be done cautiously and in appropriate time frames.
Now, you mentioned that you don't believe that we have reached that peak yet. What type of data would you use to determine if we have made it over that hump?
So we're watching our daily case rates, and it's not just the daily case rates. We often use that 7-day average, the last 7 days. So we got up, and of course we're only aware of some of the people who are positive, right? And we got up into the 400s. I think it got up to the 450 per 100,000 population. I think now we're probably 380. So we have had a decline, but it's still early. We'll use percent positivity of our testing. So the percent that are positive out of all the tests that are done, the PCR tests that done in our area, I think we were still going up on that, but we didn't get as high as Ontario in the first place. And we'll use sort of the measure of the outbreaks that we're seeing, so the number of outbreaks, long-term care home and hospital-related or other congregate settings like we've talked about. And also we have a little bit of an event, we have an opportunity here in Thunder Bay to look at the wastewater treatment data, which I've seen, the last data I have seen was from last Wednesday, and I think we might be receiving some more this week around, data from last Friday or Monday. And that will help sort of see, what's showing up there. Is it still high? Or is it showing also signs of recovery? So those are some of the examples. And even I do think that even in the next 3 to 5 days, it might become more obvious that we're in a decline, and that will then say, perhaps the peak is right now, and then we'll see that decline.
Dr. DeMille, thank you so much for joining us this morning.
Thank you again, Sean, for the opportunity.
That is Dr. Janet DeMille. She's the Medical Officer of Health for the Thunder Bay District. It's currently 7:51.